Elbow replacement. Indication is severe arthritis, osteoarthritis, complex distal humerus fractures. It's best survival for rheumatoid arthritis, low demand individuals. It can be work for chronic instability. It's unsuitable for laborers as a patient can only lift 10 pounds of weight. Types can be radiocapillary surfacing. It can be a linked D-design prosthesis, sloppy hinge like Conran-Bure, or a distal humeral hemiarthroplasty, or an unlinked, unconstrained prosthesis. Radiocapillary resurfacing can be done for the radial head fractures. A linked or a constrained D design is for more stable but higher chance of loosening. Sloppy hinge or semi-constrained Conran-Murray procedure is Murray prosthesis is used commonly. It allows anatomic varus and valgus movements about 10 degrees. May be used in the presence of ligamentous insufficiency and bone loss. Better range of motion due to soft tissue release. Reduce stress at the bone implant interface. Anterior hinge to control rotation. Good for both rheumatoid arthritis and trauma. Distal humeral arthroplasty is for comminuted fractures in young adults. Unconstrained, unlinked prosthesis. This needs complete ligaments intact, rely on soft tissue stability. It can dislocate and is good for osteoarthritis.